Hi everyone, this is Dr. Ahmed Dia Abdul Wahab and this is Highlights in Radiology, Answers to the Quiz. As I promised you, today we will have the answers for the quiz that we proposed in the episode 4 of Highlights in Radiology. So let's start. First question was, is this lesion benign or malignant? So, first of all, as you can see, it has a very well defined borders. It has no signs of cortical destruction, and there is no periosteal reaction, and there is no bony destruction, and there is no soft tissue component. So, all of these features indicate that this is a benign bone lesion, and in fact, it's just a non-ossifying fibroma. Basically, it's not even clinically significant. So, let's go to the second lesion. Is this lesion benign or malignant? Again, as you can see, there is no signs of cortical destruction, narrow zone of transition, very well defined, no soft tissue component, no bony destruction, the cortex is preserved, again indicating this is a benign bone lesion, and in fact this was a giant cell tumor. As you can see, it's extending to the articular surface after epiphyseal closure, so it's a giant cell tumor. The third question, is this benign or malignant? As you can see, it has a geographical pattern of bone destruction. It has a very wide zone of transition. It has a soft tissue component. It causes a cortical destruction. And it has this very irregularly distributed osteoid matrix, confirming this is a malignant bone lesion. And in this case, it was an osteosarcoma. Now, what about here? Again, you can see it has a signs of bone destruction, a periosteal reaction that is basically a combination of Codman triangle and a sunburst appearance. It has a relatively ill-defined zone of transition. It has some soft tissue extension and soft tissue component, confirming this is malignant bone lesion, and in fact this was an osteosarcoma. Now what about this one, the last one? It has a very well-defined border. It is a little bit expansile, however, it does not cause any cortical destruction and it does not have any soft tissue involvement. And as you can see in the MRI, it's hyperintense on T2 and hypointense on T1, and it shows some peripheral post-contrast enhancement, and this is consistent with an enchondroma, which is a benign bony lesion. So this was the answers of the quiz. Uh, Keep waiting for us. I'll see you on Friday at 5 p.m. with a new episode, and we have a lot of surprises coming. So just keep watching, keep sharing, and subscribing. This is Dr. Ahmed Dia Abdul Wahab, and this is Highlights in Radiology. Thank you. Bye bye.